Chris is examining Mr. Wilson's severe eye problems.
He's got what's called entropion, where he's got so much loose skin, the eyelashes on the end of that eyelid actually roll inwards. You can see when I let it go, they jump inwards and they sit actually on the eyeball itself. Right. It's like having that it's like having an eyelash stuck on your eye the whole time. If that keeps on happening, he will go blind. There's no two ways about it. He'll lose his vision just from that constant irritation. So this needs to be done, it needs to be done early, and they've done exactly the right thing in getting him looked at. What I propose that we do is lift up this eyelid, lift up the bottom eyelid, maybe even take a little slice out of the corner, which will actually make his eye a bit bigger, and allow that eyeball of his to actually see the world. Giving you a good look, that's Mum. It's the first time you've ever seen her. And while we're in there, you don't want any other changes to him? Maybe just take the rest of the skin away?
That's what people like about him.
You sure? We've got a whole board of dogs over here.
Any room for me?
I can do.
No, thank you.
I can do any of these. What about we can make him into a Pomeranian. Just take a bit of extra skin on.
I'm quite happy for my baby look, isn't it? I'm gorgeous. I'm born gorgeous, see? Why do you have to change it?
Good boy.
Hey, mister.
What do you reckon? That is your new look. You just put your face there. It's remarkable.
You're such a bastard.
Just like that.
4-month-old Mr. Wilson can hardly see because of the huge folds of skin covering his eyes.
No one's doing anything yet.
Eventually, the rubbing on his eyeballs will blind him. Even before his pre-med injection, Mr. Wilson is making a fuss. This spoilt Shar-Pei has never been parted from his owners.
They'll be back soon. Want a little dim sim in the meantime? There's actually quite a story behind the Shar-Pei. They were bred as hunting and guard dogs, and the point of all those loose folds of skin is actually to help them with their hunting. If they get grabbed hold of, the animal that's grabbing hold of them just gets the skin, it doesn't get the dog.
All right.
They're so ugly, they're cute. And Mr. Wilson is just the epitome of that.
Mr. Wilson's ready for the nip-tuck that should finally help him see the world. But at just 4 months of age, any anaesthetic can be dangerous.
He just doesn't have the body mass, the body size or the maturity to metabolise his anaesthetic in a normal way. So we have to be very, very careful. The hardest thing here is just working out how much skin you can take, because it's like jumping on the corner of a waterbed. The moment you hit it, the skin flies to the other side of the face, then the moment you take your hand away, the skin comes back. It's bizarre, but you have to make a bit of an estimate as to how much you can get away with. Put the stitch in, stand back, and go, looks good, or no, do it again. It's frustrating.
Mr. Wilson's quality of life depends on Chris getting the painstaking surgery right. It takes 1 hour to finish the right eye.
That's fine, but it's the left eye that's the big worry. It's the one that's really drooping over, and it's going to be quite a challenge. The worry if you take too much skin is that he gets that permanent startled look. I've been in Hollywood for 40 years. I've been to the plastic surgeon every week for the last 10. And then he's stuck with that. You don't really want that.
After nearly 2 hours, Chris is finished. But he's still concerned about Mr. Wilson's ultimate look.
The big test is going to be when he wakes up, because right now he's asleep, everything's falling down. Hopefully when he wakes up, everything springs to life and he sees everything perfectly. Mr. Wilson, you do it good, don't you? You do it good.
The next day, Chris is at the clinic early to check out the results of Mr. Wilson's eye lift.
How's it looking? I'm feeling pretty, you know.
Now you look as though you're 20.
I know, I've had 10 years taken off.
Fantastic.
Yeah.
You look like a double bay housewife.
I know, you did a good job, yeah.
It's ridiculous. Neil's got the surprise stare, which I was trying to avoid with Mr. Wilson.
Can you see me? I can see you. Yes. Great.
He does look good. He genuinely looks as though it's one of the first times he's truly seen the world, and he's a bit wide-eyed and in awe of what's around him.
I can hear his voice.
Was that him?
Sounds like it.
Owners John and Fiona have arrived to pick up Mr. Wilson.
I was missing my baby.
You always think, oh, what's it going to be like?
I should leave the jumper for him so that he should feel like I was beside him. I can't wait to see him. Yeah.
Are you ready to rock? Ready?
Oh, look, can you see better? Oh, the eyes are real clear. I see them again.
Mr. Wilson will need to be checked in another 6 weeks to make sure the eye lift has been a success.
Oh, yes, much better.
Brilliant, brilliant. Yeah. You can see the whites of his eyes. Yeah. Never before.
Yes, give Chris a kiss. Say thank you, Chris.
It's not that abnormal for dogs to leak urine when they're a little bit excited or when they're old. But for Saphira at her age to be doing it on quite a large scale is a bit of a worry.
She might be lying in bed and all of a sudden she'll get up and there's a big wet patch.
But it's like every day, constant. Other than that, perfectly beautiful, normal.
Yeah.
Definitely part of the family, as all the animals are part of the family. I know we shouldn't treat them like children, but they are. My darling.
It's clear that you really do love her. It must be getting hard though, with all the dripping.
It does, especially when you have to change the sheets half a dozen times or whatever.
Just wash
but
the
just
dirt
watching
and-
her get upset is enough to put a tear in your eye.
Yeah. So let's take this nappy off. Can I just get you just to hold her up there?
Hey, Seth.
That's not exactly what I expected.
What's the...
Well, she just doesn't look entirely normal there. I know that Joe and Lorraine are staring at me going, why is he taking so long to speak? But Safi is not your typical female dog. Do you mind if I just take her out the back just for a second?
Is this something we should be worried about?
I just want to have a closer look.
Okay.
Yeah. When I look at Saphira's belly, honestly, I'm totally confused. A hand here, mate. She's in for desexing, but also she's leaking urine.
Okay.
That's not even why I brought her out.
Back at the Bondi Clinic, a routine desexing has turned into a veterinary mystery. Saphira is incontinent, an extremely unusual condition for a 5-month-old puppy.
Wow. That's really unusual.
Her vulva is not only in the wrong place, it's further forward than it should be, but it's actually facing the wrong direction. And I reckon where you'd normally see a scrotum on a male dog, she's almost got loose skin there as well. She's got mixed genitalia.
Okay.
So that makes her a hermaphrodite.
No.
Yeah. This is so incredibly rare that I know a lot of vets that have never seen a hermaphrodite in their entire veterinary career. So it's a big day in the clinic.
And hermaphrodite has both male and female organs.
I've probably been here about 15 years and I've never ever seen anything like this before. It's really quite unusual. If she's coming to be desexed, then how do you know which bits to remove?
Well, that's the thing. She may have both internally. I reckon this is why she's having this urine leakage as well. When you realise that Lorraine and Joe have come in to have Safi desexed, aware that she leaks a bit of urine, I'm sure that they never expected that I'm about to walk in there and tell them that their little girl, maybe a boy, maybe a bit of both. It's not going to be easy. So, she's not your typical girl.
In what way?
She has her female parts down there, but she also has some evidence of male parts as well.
Okay.
She looks like she is a hermaphrodite.
Okay.
I just want you to know exactly what you're taking on here, because when people discover that dogs are hermaphrodites, and that there is a problem with their plumbing. Some people don't want to take that on. And those people often look at putting their dogs down.
No. Not even an option.
Yeah.
Not even an option. Definitely, don't make me cry. No. No, it's not going to happen. We love you. Yes.
As far as conversations go in a vet clinic, that's one of the strangest. But thankfully, Joe and Lorraine absolutely adore this dog and they'll stand by her through anything.
Okay, so where do we go from here?
If you don't mind, what I'd like you to do today is go up and see Andrew at Sash. Because that is going to be the key to unlocking why she's leaking urine.
Well, whatever she needs done for her, we'll do. Very scary. So I'm actually wanting to get her there so then we can find out and then take the next step.
We will do everything that we can to get it fixed.
I'm sorry to tell them. It's okay. You've forgiven me. All right, well, all the best for today.
Okay.
I'll obviously be waiting for the news. This started off as being a simple desexing, and now they're off to Sash for a scan to tell them whether their dog's a boy or a girl or both, and really how they can fix this leaking bladder and how they can have it desexed. It's all of a sudden got very complicated. Fingers crossed it's all okay.
Thank you very much.
Thanks, Joe.
Thank
Cheers.
you.
See ya.
Okay, see you later.
All right, next step.
Female.
Any question mark?
At Sash, Lorraine, Joe and Maddie have brought in one of Australia's rarest patients for a consultation.
Come on, sweetie.
Come on, Seth. Hey.
Chris has sent Saphira here to me today because he's taken one look at her and gone, this ain't right. She's a hermaphrodite. And that in itself is not a problem, but she's leaking urine as well, and that is a problem.
There she goes.
That's interesting.
Hermaphrodites possess both male and female genitalia. For most vets, it's a once-in-a-career case.
There's a bit odd back there. Her vulva looks like a vulva, but it's trying to migrate forward, so it's trying to be a prepuce and a penis. So she's an in-betweenie, for sure. Most hermaphrodites function absolutely normally, have a normal life. Saphira's not one of those. She's leaking urine, and that's linked to this somehow, and we've got to find out how and why.
This morning, Saphira's family were expecting their 5-month-old to undergo a routine desexing. Now the Border Collie puppy may be facing life-threatening problems.
I guess we've got to try and find out exactly what that plumbing problem is and what we can do about it. If we leave the incontinence, they do end up miserable because they get skin infections where the urine's leaking out. But worse than that is she might have been born with kidneys that aren't functioning well. If she's got that, I mean, she won't live past 2. That's the scanner that she'll be in later.
Oh, right, okay, yep.
Saphira will undergo a CT scan to discover more about her mysterious anatomy.
I'm trying to be calm. Just wait and see what happens, because otherwise our mind's going to get too far ahead and then I'll get too upset.
Look, it is a tough day for Lorraine and Joe. They, thought she was just going to get desexed and, oh, yeah, she's got a little bit of a problem, can we give her a pill? And it suddenly turned into something that's bigger than Ben-Hur.
Oh, good girl.
Saphira's CT scan is now underway at Sash.
Gosh, we don't see this very often.
No, we don't.
The initial diagnosis has indicated that being a rare hermaphrodite may be the least of the puppy's problems.
We know she's leaking urine. We don't know why. We don't know what part of her urinary tract is not functioning properly. So we need to do a CT scan using dye that we'll give intravenously. That'll highlight the kidneys and then highlight the bladder and the entire urinary tract. Bladder's just looking a bit weird. See? Yeah. The bladder should be essentially spherical or balloon-shaped, and yet she's got this big bit kicking out here to the right. That's weird.
Even the CT scans are providing more questions than answers.
The fact that she's a hermaphrodite is making this even more difficult to interpret. We're not dealing with male anatomy, we're not dealing with female anatomy, we're sort of dealing with a combination of both. And incontinence cases can be hard enough to diagnose if you've either got a girl or a boy. But when we've got this combination, it's making it really tricky to figure out what we're doing.
The case is so confusing, Andrew has decided to make Saphira a global issue.
I think we need a specialist CT radiologist to have a look at it.
The puppy's scans will now be emailed to a team of specialist radiologists in England. The results should be back tomorrow morning.
I'll have to wait to give a final decision or verdict, if you like, to have had that done. Look, the good thing is the kidneys seem to be fine.
Oh, good.
So that's good. But what I can't really figure out is what's happening to the tubes after they come out of the kidneys, where they're going in, and then what's happening after that. I think we need to keep her here overnight. I'm sorry. That I wish I could give you a clear-cut answer, but veterinary medicine is not always like that.
Well, when you hear the specialist say that he's not sure and he's got to send it off to a specialist, then you sort of get a bit...
While the puppy sleeps off her sedation,
She's going to have to stay in here tonight.
Lorraine and Joe must now break the news to their daughter Casey.
Don't make me cry. You okay?
Hey, sweetie. Hey. Doctor will give us a call first thing in the morning. Look, tomorrow we'll find out. Don't fret. She'll come home a whole new baby.
Joe and Lorraine, they're amazing. They just want the best for her. But whether I can actually fix her problem surgically, I don't know. Where are you, Safi? We've just got the second lot of results back, and they're about as helpful as the first lot.
5-month-old hermaphrodite puppy Saphira is proving to be one of Andrew Marchevsky's most baffling cases.
You're a bit of an enigma, aren't you? Enigma wrapped in a puzzle.
Despite a battery of tests and 2 sets of CT scans sent overseas for specialist analysis, what's causing the Border Collie puppy's incontinence is still a frustrating mystery.
Lorraine and Joe have agreed that we've just got to take her to surgery now and find out exactly what's going on and get her fixed. Come on, let's go. I can't do any more tests, none that'll help us. And at some point, you just got to draw a line in the sand and say, right, let's get in there. Hey, sweet, you're a problem. There are people all over the world scratching their heads and squabbling. Come on then, we'll get you sorted. And if we can't fix her today, she'll end up with chronic incontinence, chronic infections. She'll be miserable. There'll be just discomfort all the time, and she could get really sick. So we really need to get it sorted today to give her a good life. Here we go.
The pressure on Andrew is enormous.
I've never seen anything like this, no.
This is a career first for one of Australia's most experienced and respected veterinary surgeons.
Hermaphrodites are really rare. Hermaphrodites with major plumbing problems are even rarer. So if I see another case like this in my career, I'd be lucky. Where we need to get at's stuck right underneath her pubic bone, and I just cannot get to that area. The only way I'm going to be able to get to that is if I split her pelvis open. All right, well, I think we're going to have to do this. It's not what I wanted to do because it's turned it into a bigger surgery and more painful one for her. But if we don't do it, we won't fix it.
With clear access to Saphira's abdomen, Andrew can now see a small hole in the puppy's urethra.
It's just starting to see where the urine's been pooling. But basically what I've done now is I've actually tied off the join between the uterus and the urethra. So it can't pool anymore. So that's her uterus, testicles and the start of her penis. It's all a bit confusing, really. We basically got rid of what I think is causing the problem. and then desexed her along the way. That is that.
It's taken more than 4 hours, but Saphira's groundbreaking surgery is now over.
It went really well. It was really challenging. But the only way we'll know if we've been successful is she stops leaking urine. So it's going to take us a little while before we know whether we've been a success or not.
Finally, Joe and Lorraine are allowed in to see their little girl.
Princess. Baby. How adorable does she look?
I really don't think you can use the word she, because she literally was half and half.
She's still our little girl. She'll still be treated the same and loved the same.
I mean, they've shown amazing dedication and amazing patience to get us to this point, you know, because it hasn't been simple, and hopefully we've got it fixed.
Where are you, Saf? Settle, pedal. Settle, settle. I know, Gold. You're a good dog. You're very clever. Have you got a dry bed? That's a dry bed. Yes, it is. You're a very clever dog.
As for our hermaphrodite, it's been 5 days since Saphira's operation to stop her incontinence, and it appears to have worked.
We've been keeping a really close eye over her the last couple of days, and the great news is she's got a dry bed, so she doesn't have pools of urine leaking while she's asleep anymore, and you know, she's fixed. Thank you for the kiss. Oh, thank you for the kiss. I think I have to get you home now. That was a goodbye kiss.
It's been an emotional journey for Joe and Lorraine, but it's been particularly hard on their daughter Casey, who hasn't seen her baby girl for more than a week.
She's all good now.
Saf, who's that? Yahoo, look out! Yahoo!
It's been a crazy story. I literally did lose sleep thinking, you know, once I got in there, was I going to be able to fix it? Because I didn't know. But to see her at the end of that fixed and jumping around like she's normal is, you know, it's really satisfying.
It's a pleasure.
Thank you for looking after her, all the staff, for looking after her the way they did.
It has been a pleasure.
And especially you for...
And it was a good result. I'm not sure I want another patient like Saphira for a little while because, you know, my brain can only handle so much.
Look at him.
Something is seriously wrong here. His voice is paralysed and he's really swollen around his mouth.
The poison from one paralysis tick is enough to kill this tiny puppy.
Where is the tick? Where is your tick, buddy? I can't guarantee 100% that he's going to survive. He could deteriorate in the next 24 to 48 hours, and all I can do is hope that it doesn't happen. You're not feeling good at all. It's okay. It's all right, you know.
Little Jack Russell pup Scout has been rushed into the Bondi Referral Hospital SASH after becoming ill and collapsing at home.
This little dog's only 3 months old. He's been wobbly in his back legs, he's groaning, he's had some vomiting. I'm really worried that he's got a tick.
It was devoted dog sitter Kathleen who brought Scout in, convinced he's suffering from tick paralysis.
We're looking after these two puppies, Scout and Bella, and we got home and there was clearly something wrong with Scout. So we phoned SASH, we rushed over here and they're busy looking after him at the moment, so we'll see what they're going to say.
Okay. Something is seriously wrong here. His voice is paralysed and he's really swollen around his mouth. Hey, buddy. I don't like how you're making that noise.
It appears that poison from a tick has already begun shutting down little Scout's system. It's now a race against time to find the tick before it begins paralysing his breathing muscles.
Where is the tick? Where is your tick, buddy? Every minute that we wait, it's injecting a lethal toxin into his system, causing this paralysis. We need to get it out of him and treat him as soon as we can. Okay. Oh, here it is. All right, buddy, we found it now. That's okay. It's right around his lip. There we go. Oh, sweetheart. So we've taken the tick off Scout, but the treatment is nowhere near over yet. Now we need to sedate him, keep him as calm as possible, give him some life-saving tick anti-serum, and hope like hell that he doesn't deteriorate.
All right, all right. It's okay.
At Sash, the poison from a deadly paralysis tick is shutting down little Scout's system.
It's okay. All right. The worst is done.
It's now a race against the clock to get the tick anti-serum into him before he is completely paralysed.
We are under the pump here. We've got to get this into him really quickly because if we delay it any longer, he can get worse and fast.
It's all right. Hold on.
Scout's had his tick anti-serum, and next we need to shave off all his hair to make sure that there are no other ticks hiding there, and then we'll give him a spray with a tick treatment just to be safe.
He's a brave puppy. You're all right. Good boy. Sorry, Scouter, we've just got to make sure you've got no ticks left. I know you're sick of it. You're being very patient. Just got to make sure we've got them all so you're not going to get any more sick.
Suddenly, the nurses discover 2 more ticks burrowed deep within Scout's skin.
That looks like a baby tick. Just right there on his belly. Oh, sweetheart.
The poison from one paralysis tick is enough to kill this tiny puppy. With 3 ticks, Scout is now in serious trouble.
Scout is really anxious and distressed. The most important thing I can do now is sedate him, keep him as calm as possible, because if he stresses out and panics, he's at risk of aspirating, obstructing, and that is life-threatening.
Devoted dog sitter Kathleen and her 3 children are allowed in to see the sick pup.
I feel really sorry for Kathleen. I can't guarantee 100% that he's going to survive. He could deteriorate in the next 24 to 48 hours, and all I can do is hope that it doesn't happen.
Okay, you're nice and cozy there. We're going to get you feeling a lot better, sweetness.
At Sash, Lisa's worst fears are realised. Tiny tick victim Scout is in the oxygen chamber, fighting for his life.
Scout's taken a turn for the worse. He's developed breathing problems. He's now in the oxygen cage, heavily sedated. I was hoping that it wouldn't go down this path, but it might just be a sign that we've caught him too late.
All that Lisa can do now is hope and pray that Scout can find the strength to pull through.
I'm just really upset that he got to this point. He's such a tiny little puppy, and now his life is really hanging in the balance.
Just have a little rest now, honey. It's a good boy. Have a little rest. Who's feeling better? Yes, hello. Hello.
At Sash, little Scout has made an amazing recovery after being bitten by a deadly paralysis tick.
As soon as I lay eyes on little Scout, I can straight away see that his demeanour has completely changed. That little tail is wagging 1,000 miles an hour. He wants to play, and that's how a puppy should be. Oh, you're a cutie pie.
I think you're feeling better. Yeah, not eating my finger. What about some real food?
The final test in his recovery is to see whether or not he can eat. Wait, look what I've got. Oh my gosh. Oh my gosh. Scout's doing so much better. He's full of energy and has now just eaten a full bowl of food with no problem. So I think he's ready to go home.
No one is happier about the 3-month-old's recovery than his anxious babysitter Kathleen, who's waiting in reception with Scout's sister Bella.
When I heard the news, I just felt a wave of relief. This little beautiful thing is fine. He's young, he's 3 months old, he's full of vitality. Thank goodness.
Let's go. Come on.
Ah, look at him. And he's better. Hey, look at them. They're saying hi. And you survived. You're okay. I can't believe
very
it.
close at one stage.
Hey?
I didn't know if he was going to even pull through, so...
Yeah, I was very worried. And here he is, himself.
Even though Kathleen and the family are not their real owners, the thought of them losing Scout would have been absolutely terrifying, and they are so excited to have him back in their arms.
Here we go, a happy couple.
You guys ready to look after them? Yes. Especially this one. Now, you're a handful. You be good.
Can you see?
And be nice to your sister, please. The amazing thing here is that when Scout's owners left him to go overseas, he was healthy. And when they get home, he'll be healthy too. It's like none of this ever happened.
Push, push. Okay, let's go home.
See you later.
Okay.
Good luck. Bye.
It's just full of...
So what's been happening? What's going on?
We thought we had something stuck in her mouth, but we tried to open her mouth and she yelped terrible pain, and her eyes a bit gooey.
Emergency vet Dr. Lisa Chimes checks for any telltale signs of what's causing such intense pain.
Now you're going to let me open your mouth and see? Oh, she doesn't even want me going near the mouth, does she? Oh, puppy girl. You want to let us do this? Hmm? Sweetie. Daisy is really in a lot of pain. Her left eye is bulging forward and her jaw is so sore that she won't even let me touch her mouth.
Let me have a go. Yeah, let me put it... No, all right, Daisy.
The eye doesn't actually look abnormal. It's more the tissue surrounding the eye that doesn't look right. Something's causing it to pop forward. When there's inflammation in that eye area and you open the jaw, it puts pressure onto that sore spot. And that's quite a classic finding that we see with animals that have got problems behind their eye. They're painful when you open their mouths as well. We could be looking at something like an abscess. It could be something stuck up there. Worst case scenario, it could be a tumour. Look, she's a young girl, and I think that's much less likely, but we do have to rule that out.
Oh, you poor thing, eh?
I don't like seeing her like this at all, and you know...
What I think we should be doing is a CT scan. She'll have to have an anaesthetic for that, but that allows us to see the whole skull and all the soft tissues and everything around the eye, and hopefully we'll see what's going on there. The fact that it's come on so quickly and she's so sore, we have to do something.
Let's do it. Let's get it, get it done.
All right, Missy Moo. Good girl.
At SASH, Lisa is about to give Daisy a CT scan to find out what's causing the painful swelling around her eye and jaw.
Hey, Chris. Got her here.
Hey, Daisy. Hello.
All right, so we're ready to CT her head?
Yep.
Yep, okay, fantastic.
Daisy has to be anaesthetised for the scan.
You're such a good girl. Your eye's sore, honey. It's so swollen.
All right, Days, let's do the tube. Oh, that mouth is sore, so even under anaesthetic. If she's in pain under anaesthetic, you've got to imagine how much pain she's actually in when she's awake. We've really got to get to the bottom of this for this poor little girl. That's the way. I'll just turn you around, Missy Moo.
At SASH, Lisa is giving Daisy a CT scan. She's trying to identify the cause of the Cocker Spaniel's swollen eye and painful jaw.
Daisy was yelping even when I was trying to open her mouth to put the tube in, and she was half anaesthetised. So you can imagine how much pain she's actually in when she's awake. All right, so I'm just looking at the CT now, and what we are looking at is a slice through Daisy's head. This side is supposed to look like that side, and you can see how much more tissue and swelling there is behind that left eye, and that's where Daisy's pain is coming from. I can see that there's no obvious tumour, there's no obvious abscess. I can't find any foreign material or something stuck behind the eye. Most likely, I'm thinking something like cellulitis.
Cellulitis is an aggressive bacterial infection that can spread rapidly.
I do want confirmation from our radiologist, so I'm going to send the images to them. But in the meantime, I think it's best that we start treatment quickly, because if we delay it any longer, that infection is going to continue to spread. That's life-threatening. Out you come. That's a girl. I know, you've woken up a bit more. Yeah, you have, I know. You're such a good girl.
Lisa has kept Daisy under 24-hour observation to see if antibiotics reduce the pain and swelling in her face.
Right now, we don't have a 100% diagnosis as to what's causing Daisy's problem. In the meantime, we're going to treat for cellulitis, because if we don't, she's going to get worse and fast.
Yesterday, owners David and Margaret brought the 3-year-old Cocker Spaniel to Sash, suffering intense pain.
You're a wounded little soldier, aren't you?
Hidden cuts or abrasions can cause cellulitis, but Daisy has no visible injuries, so Lisa's hoping she's on the right path.
That's a girl. So I've given Daisy an anti-inflammatory and an antibiotic, and she's on a drip because she can't eat properly. Now all we can do is wait. Hopefully that will make you feel better soon, Bubby. Hi, Daisy. Hi. I know. You're looking good and very happy. My goodness, that's so much better. That is so much better. Hey, it's gone right down. It has. Can I get you out? You want to come out with me? That's a girl. Good girl. Let's have a look. Can I have a look at you? Wow. Yeah, that's great. Daisy is so much brighter compared to how she was when she arrived. She's friendly and wagging her tail. This is a really good sign. So much better. Yeah, you're looking great. Hi.
It's been 3 days since Daisy was first treated for cellulitis, and it's now time to go home.
Can I get this on? You gotta wait. You gotta wait. Hey, I know. Daisy, wait. Daisy is clearly feeling much better. I can't even hold her still. Are you ready to go? Yes. Yes, I am. Yes, I am. The swelling's gone right down. She's comfortable. She's happy. I think she wants to go home. Okay. Let's go. Let's go. Let's go. Come on, let's go. Yeah. You won't believe who's around that corner. I think you know. Oh, God, look at her.
You're like a new doll.
Oh, Daisy.
Have a look. You couldn't open your mouth last time we saw you, could you? Hey? What a good girl.
Looked after you here.
Yeah, have they ever? Give me a wash in the bath.
Oh, it's such a relief that it's cellulitis and it's nothing worse, and we can take her home, and it's wonderful. So it's a very good outcome from a very dismal looking situation to start with.
Daisy, see you later. She doesn't even want to look at me. She's out of here.
Thanks very much.
Thanks for the appreciation, Daisy.
Thank you.
See you later. Bye.
Hey, good boy.
Apollo's been brought down to us today because his owners found metal stuck around his back tooth.
He was outside in the garden today. We have no idea what it could even be or where it's from.
Owner Lani acted quickly when she saw Apollo in trouble.
It's quite concerning, so I definitely had to rush in today. Hopefully he'll be okay.
Okay. One little quick peek if we can.
You can see it's stuck in the side there. It's gone right into his gum.
Oh, wow. Yeah, definitely something there. That is not going to be easy to remove. If you don't get that out, there's a possibility it could stay there and actually burn down into the bone, or if he actually swallows it, that could actually perforate his stomach. Okay. Small little needle. Small little needle. Good boy. Good boy.
Boy.
Oh, you're a brave man. Okay. I've given Apollo some pain relief and he'll soon feel a lot better, but there's no way that he will allow us to remove that without an anaesthetic. Okay, Apollo, it's all right. And give some time for that pain relief to kick in. There we go. There you go. Stay there.
He's naughty.
He's so cheeky.
Because he's cute, he thinks he can get away with like a lot of things. But
Yeah.
it works. But you fell in love with him like straight away. So you started to be like, I love him so much.
Cute.
Yeah.
Now that Apollo's had his pain relief, we can give some time for that to kick in and develop a plan. Oh, good boy. It's time to try to get that thing out of your mouth, yeah?
Gerardo's worried that if he doesn't remove the metal quickly, Apollo could swallow it and perforate his intestine.
Good boy. So replacing an IV catheter. This will enable us to give him anaesthetic so that we can have a look in his mouth and hopefully remove that metal object.
Very brave.
Almost there. Oxygen's on. Anaesthetic is on. My concerns are that this piece of metal is wrapped really tight around his back tooth and it could be pretty difficult to remove. Oh, look at that. Ow. That is one side of a U-shaped clip. That has pushed through his gum. Must be painful. I think I'm gonna have to cut it off. So what we'll do is we'll flip it up this way and I'll get the bolt cutters and then we'll try to get that off. Got the cutters.
Could you get any smaller ones?
Yeah, could. But these ones, I like these ones because nice and precisely cut something without having to use your wrists. Okay, you ready? Hold them still. Hold them still. 1, 2, 3.
Wow.
See? Nice and easy. There we go. It was like this. Somehow he swallowed that and went over his tooth, and these edges here, these little indents here, went on either side of his molar and burred away at the gum and also at the bone there. Now that the clip has been removed, I can see that the bone has been burred away and the root of his tooth is exposed. I'm hoping that the gum will heal back over, otherwise Apollo may need to have that tooth removed. The only thing we can do now is give it time and see if that heals. So let's wake Apollo up, but I'm fairly certain you'll be happy that that's off his tooth now.
Definitely.
Here we go. Good boy, good boy. Good boy, Apollo. There we go. Good boy. Once Apollo's up and walking around, we're going to offer him some food and make sure that he's able to eat on that side. And if he's okay with that, he should be fine to go home. Oh, Apollo.
3 hours later, Apollo has woken up from his anaesthetic.
We got some chicken. I just offered Apollo some chicken and he hoovered it down. And he didn't have any signs of pain. And I checked his gum and there doesn't seem to be bits of chicken stuck in it, so he should be fine to go home now. Good boy.
Now that it's over and done with, I feel relieved. Definitely excited to have Apollo back. We've been waiting by the phone, seeing when we can come get him, so we're excited to see him.
Apollo's relieved owners, Lani and Dakota, are keen to take their cheeky boy home.
Mummy and Daddy are in here. Apollo, get this way. Oh,
You're so silly.
So, it was...
Oh my goodness.
Like that. That must have been there for like at least a couple of weeks, I think.
Oh my goodness.
For it to go to that degree.
Thank you so much. Oh.
Thank you so much.
No problem at all, guys.
You look a bit worried.
Has anyone mentioned anything to you about his heart?
No.
My gut feeling going on how Tyson's heart sounds and feels is a patent ductus arteriosus, a PDA. And
can it be fixed?
I don't know. Hello.
Hi,
You must be Melissa?
Yes.
This is Tyson.
Tyson.
Oh, Tyson. I was warned that he was cute.
He's cute.
Melissa is fostering 3-month-old rescue dog Tyson.
All right, come on through.
but hasn't decided yet whether she's going to keep him.
Hey, little buddy. He looks reasonably lively, but he just does look a little bit skinny. What's that? Oh, is that the spot, is it? So, Cinezo is obviously just a temporary thing. You two aren't bonding at all?
No, not at all. No, he's beautiful, and the kids love him too. You look a bit worried.
Has anyone mentioned anything to you about his heart?
No.
So his heart isn't doing a normal lup-dub like that. It's actually, it's whooshing. And if you put your fingers here, you feel that? Like a little vibration?
Yeah.
So my gut feeling going on how Tyson's heart sounds and feels is a patent ductus arteriosus, a PDA. And if this is a PDA and Tyson doesn't have heart surgery, this condition will eventually weaken him and kill him.
Can it be fixed?
I don't know. You're having all this fun with a puppy and then all of a sudden, bang, everything changes.
You're scaring me.
Can I ask you, is this going to affect whether you're going to actually keep him?
I'll keep him now. I can't send him back if there's something wrong.
Yeah?
Yeah.
I'll make a phone call and see if I can get him into our specialist up at Sash.
Okay.
You've got to remember that Melissa hasn't actually formally adopted Tyson yet. So for her to face this crisis and face up to it and go, yep, I'm going to stick with him, that's really something.
Right, Squirt, let's put you up here.
Oh, you're very, very tiny on this big table.
It's very tiny. It's very quiet too.
Oh my goodness.
At Sash, vets Darren Foster and Lisa Chimes are about to give Tyson an ultrasound to find out if Chris's grim diagnosis is correct.
And there it is. Wow, so you can see this dramatic flash of colour going from the left-hand side to the right side. No doubt at all that this is a PDA. I'm afraid for little Tyson, he's going to have some major heart surgery to try and fix him. Poor little kid.
It's basically an abnormal vessel between their aorta and their pulmonary artery, and all humans and animals have that vessel when they're in the womb, but when they're born, it's supposed to close off within the first few days of life. And in Tyson's case, that vessel hasn't closed off, and you've got blood basically shunting backwards in the heart.
PDAs will eventually cause him to go into heart failure if they're not treated.
But he's going to be okay. Can you fix it?
Well, Andrew's here.
Surgeon Andrew Marchevsky will be performing the extremely delicate operation.
What do you actually need to do?
Well, we're going to have to go into his chest, so we're going to make a cut on in between his ribs and sort of open him right up, so we'll have the heart sitting there pounding away at us. And then you get a pair of forceps and get round behind it and then tie some suture around it. Unfortunately, there's a risk involved with it. The shunt itself, or the abnormal vessel, is quite thin-walled, and there is a risk that we can rupture it.
There's no way I'll give him up now. There's no way. He's here to stay.
Getting really nervous now. I know, it's going to be sad.
Rescue puppy Tyson is returning to Sash for his life-saving heart surgery. This family were only supposed to be looking after him for 1 week.
Hi, Melissa.
How you going?
All right, got everybody here today.
Everybody's here today to say goodbye.
Oh, well, not goodbye.
Not, or just good luck.
See you later.
Yeah, see you later. See you soon.
Has he grown a bit?
Now, despite the operation costing thousands of dollars, they have decided to keep him.
Say bye to Tyson. Say bye. Beautiful Tyson.
I'm really, really nervous for him, because he's so little.
It's sort of like a bit of a time bomb. He could just suddenly die of heart failure at any moment. They're in the chest. I just have to push some lungs out of the way. If I put my finger on it, I can feel it vibrating. And that's just because the blood's going in the wrong direction. So we've just got to get round this little bugger and get him tied off. I've just dissected down the front and back end of the shunt, and that's easy enough to see. Now I'm going to be going around the back end of it, which I can't see, so I'm going to be doing by feel, and if ever anything's going to go wrong, it's during this bit. So they're not going to talk for a while now. It's always a bit tense. It's you're dissecting blind around the other side, and you're doing it all by feel.
At Sash, Tyson's life is in Andrew's hands. The surgeon must now tie off the abnormal vessel that's causing the rescue puppy's deadly heart murmur. This is where the smallest slip can be fatal.
You've got to be really careful, really patient, really gentle, because if you start pushing it a little bit and you're in the wrong spot, it's a disaster if you push through the blood vessel, and they just die. Whew. There's that sigh of relief. So just tying this off now, you can see his blood pressure changes and that reverberation in his heart's just disappeared. So he's a cure.
Despite the great result, it will still take Tyson several days to recover.
And it's funny, I mean, you look at the published risks of mortality are 2%, but it's just the fact that it's the complication in the surgery's death. It's a big complication.
You get it.
He's crazy. We want to keep him, but we're so happy to send him home looking so bright and happy.
4 days after his operation, Tyson's heart has the all clear and the popular puppy is heading home.
Come on, Tyson, it's time to go home. Good boy. Come on. Go and walk out. I know. That's it. Oh, so good boy. Come on.
Hello. Hello. Hey. It's a puppy.
Thank you so much.
No, that's a pleasure.
Hey, you want to come home? You want to come home?
At the end of the day, we've got a happy dog, happy owner, happy surgeon. It just doesn't get better than that.
Danny is struggling to walk and breathe.
He came in here when he was about 8 weeks old. He was bitten by a tick and almost died. He was on a ventilator for 4 days.
And we were so worried he wasn't going to make it, and we all became so attached to him, and I'm just so worried about him being back here so soon.
This time, owners David and Rosaline are convinced a plastic object is stuck in Danny's throat.
Oh, sweetheart.
He had a feel, and he said it's something...
It's a long plastic.
If Mr. Lamb hadn't felt something stuck in Danny's throat, then I would be absolutely certain that he's got a paralysis tick.
Okay, let's get an x-ray.
Danny's just a baby, and it's cruel that he has to go through something like this again.
Such a rigor.
Danny's choking is getting worse. His owners believe he swallowed a plastic object, but Lisa fears he's been bitten by a paralysis tick.
I have to take this just for their peace of mind, because they said they saw something in his mouth.
Oh, it looks pretty good.
X-rays show Danny has nothing wedged in his larynx.
It all looks normal. Oh, right. So, you won't believe what I'm going to tell you, but I think that he's probably got a tick. Again. What a tick does is it paralyses parts of the body. So they have a toxin that they release into the bloodstream when they latch on, and that causes paralysis. And it can affect anything from the back legs to the upper airways to the breathing muscles. Potentially, one bite from a tick on a susceptible dog can cause death.
Lisa is searching Danny for potentially fatal paralysis ticks.
Danny has deteriorated rapidly since he arrived. I mean, he's becoming more wobbly. He's lost his ability to swallow. Look at that, that's so different now.
Within minutes, a tick crater is found on Danny's cheek.
Looks like a crater.
It does. And the fact that it's on his head and he's got these signs of gagging, it would all fit in. Hey, sweetie.
Lisa is now convinced of her diagnosis and immediately gives Danny the anti-serum to try and stop the toxin spreading through his body.
Danny boy. So we're going to run the anti-serum in before we even look for more ticks because I don't want him to deteriorate any more than he already has. There we go. The sedation has really kicked in quite nicely.
The search now begins for any more lethal paralysis ticks that might be buried in Danny's fur.
We found anything? There's one.
This is a tiny tick. I mean, they can get to 4 times the size of this easily, but such a small thing can be deadly to a dog.
A tick dip is being given as an extra precaution. It's a good bath. Danny will need to be monitored around the clock to make sure there's no life-threatening relapse.
I just hope we've got it early enough that he doesn't have to go on a ventilator because that would just be awful.
Not that great, buddy.
Danny has survived the night after his second battle with a paralysis tick, but there are still worrying signs.
Still not great. Tick paralysis can affect different dogs in different ways. His main problem was that he couldn't swallow. And if you can't swallow, then that means your food sort of just sits at the back of the throat and there's the risk that you can inhale it and that can cause a big infection in the lungs. Danny has had pneumonia before when he had tick paralysis and it took him over 6 weeks to recover from that, so we just don't want to go there again.
Until Danny's swallow reflex is back to normal, the hungry puppy will stay on a drip and will not be allowed to eat or drink. Tick bite victim Danny is finally allowed to eat after fasting for 48 hours.
One at a time. Wait. No. Oh, you're starving.
Lisa is now confident his swallow reflex is back to normal.
That's it. You keep that down and you can go home.
It's not going to have any more hair. I'll shave it every week.
No, you're not.
Rosaline is worried Danny's new haircut has made him look like a different breed.
Yeah, short hair Labrador. Now, I have to put a sign up on his head when we go walking that he's a golden retriever. Okay, yes, I miss you too.
He looks a bit like a Labrador, don't you think?
Don't ever say that.
Don't say that. No, we're just teasing. You're a golden retriever, aren't you? Danny's just gorgeous. Hopefully he'll be back for a visit for cuddles. No more ticks, and they're under strict instructions to check him every day. Bye. This is really bizarre. Bella picked up a pufferfish 8 hours ago. She's clearly in a lot of distress. She's very weak. She can't stand. She's got tremors.
The toxin in pufferfish is actually, I think it's 1,200 times more powerful than cyanide.
She should be dead right now.
At the Bondi Referral Hospital SASH, Lisa is confronted with a rare emergency. 1-year-old Bella has bitten a deadly pufferfish on the beach.
Hey, darling, can I pick you up? Right, okay. All right. Okay, so Bella apparently picked up a pufferfish this morning. She's been vomiting all day. She's clearly in a lot of distress. She's very weak, she can't stand, she's got tremors. Pufferfish are extremely dangerous. I mean, usually an animal should be dead within 60 minutes of biting one. Within half an hour, they have struggling to breathe and they need to be put on a ventilator. So this happened this morning. It's now been several hours and she's only starting to show these sorts of signs later. So it is quite atypical, but I am worried. This is really weird. I've never actually seen anything like this. I just want to make sure that she can breathe and ventilate properly, because the worry is that the diaphragm can get paralysed and that's when they die.
In reception, a quick search of the internet is not helping Bella's owner, Greg.
Just did a check and it's the toxin in pufferfish is actually, I think it's 1,200 times more powerful than cyanide. So obviously a little bit goes a long way for a poor little dog that small.
Oh, baby girl. Okay. You're okay. You're okay. I know. This is really bizarre. Bella picked up a pufferfish 8 hours ago. She should be dead right now. There's no treatment for pufferfish toxicity. There's no antidote at all. So Bella needs to be treated with a drip and pain relief and sedation. And then we need to watch her really closely to make sure she doesn't need to go on a ventilator. Just have a sleep again. Sorry to disturb you, sweetie.
It's a rare case and Lisa is searching for answers.
What we do know about the toxin in pufferfish is that it's one of the most deadly toxins in the world. It's the same sort of toxin that's in blue-ringed octopuses. It's called tetrodotoxin. So what it basically does is it shuts the nerves down all over the body. I must admit I haven't actually ever seen anything quite like this.
Bella's owner, Greg, is struggling to cope with the news.
Worst case scenario with pufferfish toxicity is that it can affect their heart, so it can make the heart basically stop. Usually if they're going to improve, whether they're on a ventilator or not, they will take, say, 24 to 36 hours to get better.
She's still with us, so she's going well.
Greg's now calling his wife, Carolyn. Little Bella may be running out of time.
Oh, sweetheart. Yeah.
Here you go.
Greg's wife, Carolyn, has arrived at Sash to comfort the critically ill Bella.
Bella just turned 1 yesterday, so she's still a baby. And she's such a cheeky little creature. She's like, she's just cheeky. She has a really cheeky little grin. It's amazing how little, hairy creatures can just touch your heart.
We don't know what's going to happen over the next few hours, so we'll just take it hour by hour, I think. Who's a sleepy one?
It's also a long night for Lisa at Sash as she keeps checking on Bella's condition.
Can we see if you can stand these? Okay. All right. You don't have to do that.
The little schnauzer is lucky to be alive after biting a poisonous pufferfish.
She's still not good. She still hasn't got control of her legs and her head's sort of swaying around and she's groaning. She still doesn't want to be touched, so the toxin is still in her system.
But when Lisa puts the shaky Bella on the floor, she's showing plenty of courage.
Come here. This is pretty amazing. I mean, Bella's still fragile, but she's standing and she's even walking. Yes, she's wobbly, but she's walking. She's getting there. She's sort of just learning to use her legs again. She's still a bit wobbly. Oh my goodness, now I can pick you up and you don't quiver.
Several days after biting a poisonous pufferfish, Bella has made an extraordinary recovery.
Look at you. She's got her normal strength and she's bright and happy and running around, wagging her tail, and her mum and dad are going to be very excited to see her.
Carolyn and Bella's big sister Coco have arrived to take her home.
Look at there! kisses. Really, really lucky little dog, because following the textbooks, she should have been dead within an hour, not with us. So it's almost a miracle. It's fantastic.